Well, you probably noted a change in my tone last week, and I think it was the weight of all of those new pieces of information colliding all at the same time in terms of creating a perfect storm for having these challenges that we're facing right now. So we have increasing number of cases around the world, increasing numbers of variants around the world. We know they're in this country. We know that they're in our province now. We've tried to put in all of tighten up every measure of every layer of protection we can, from border measures to travel restrictions to gatherings to keeping people in orange around the province who don't have cases in terms of the zones and keeping the steady 20. Every single measure that we can strengthen from a public health perspective, that is what we're doing right now. In advance, we were planning to do that in advance of the variants arriving, so that then we would have a better ability to try to either stamp it out quickly or stay ahead of it once it arrived. As of right now, I think we have put everything in place that we can. The next conversations at the national level and at the provincial level have involved talking about the details of case management now of these cases. So when you have a case of the variant, what does that mean around contact tracing? What does that mean about self-isolation? Do we have to make changes? So those are the conversations we're having right now. But I think in terms of every strengthening of every measure, and again, I've got a little diagram to remind myself of that Swiss cheese approach with all those barriers. So border measures, self-isolation, masking, physical distancing, hand washing, your close contacts. You know, if the variant gets through all of those layers of protection, it only takes one case to start an outbreak. I mean, of the old variant, every single outbreak that ever started was because of one case, and the case can lead to other outbreaks in other areas, long-term care facilities, which then affects healthcare workers, which then affects hospital services, which then can cause, you know, a zone to go to red and then go to lockdown. So it only takes one case to have those consequences. But the problem now with the variant is that each one of those cases that gets through all those barriers can then infect many, many more people very, very quickly.